Hello everyone, in this video I'm going to be answering some questions that some health practitioners have been asking, that perhaps the United Kingdom is not recruiting in their countries anymore, like countries like Nigeria, Ghana, Niger, Cameroon and the likes. Some people have been asking that, okay, I've submitted an application, they've not gotten back to me and the likes. I will answer this question formally in the way that the government of the United Kingdom has stipulated, if they are still recruiting in Africa or not. So diving into the video, some people have actually been asking, okay, is UK not employing in my country anymore? And I'll be talking about this. What happens is that there is actually a WHO list, which many people call the red list. So every country on this red list are having issue with their health care. Some, they don't have enough doctors. So in these countries, the United Kingdom is not actively recruiting in these countries. So let's look at what the United Kingdom government has to say about this country. So about active recruitment in this country. So active international recruitment in the code is defined as the process by which UK health and social care employers, contracting bodies, recruitment organization agencies, collaborations and subcontractors target individuals to market UK employment opportunities with the intention of recruiting to a role in the UK health or social care sector. It includes both physical or virtual targeting, and whether or not these actions lead to substantive employment. This can include, but it's not limited to, advertising to candidates through any medium, incentivization activities such as referral bonus schemes, referring candidates to specific vacancies in the UK in return for a fee from the employing organization. So, and here coming down, he said the only exception to this definition is where a candidate has already been appointed by a UK employer following an independent direct application and selection without the support of a recruitment organization, agency or collaboration. And what they mean by direct application, this is what it means. For the purpose of this code of practice, a direct application is when an individual makes an application directly and on their own behalf to an employing organization. Direct applications do not use a third party such as recruitment organization, agency or collaboration. So what this law is stating is that the United Kingdom will not actively recruit in any country that is on the red list. And if we look at the countries on the red list, we have Nigeria, we have other countries on the red list like Madagascar, Malawi, Mali, Mauritania, Mozambique, Nigeria, Rwanda, Senegal, Sierra Leone, South Sudan and the likes. So the UK government will not actively recruit in this country, and because there are some employment organizations that collaborate with NHS institutions to recruit and target individuals in different countries, but countries on the WHO red list are not targeted and the collaborators are not working in such country. But the exception is that when there is an individual application, that is, you can apply as a medical professional to healthcare in the United Kingdom, or you can apply to an NHS institution in the United Kingdom on your own. So if you apply on your own, employment can be granted onto you. So it's not an active recruitment, it's a direct application. You directly applied for it. It's not it is not advertised to you. So you can still get medical work in the United Kingdom, but it's not an active recruitment. I think Nigeria and some other countries have been on the list for the past 5 years and they are still there currently. So probably when they update the list, it may not be there or it may still be there. And so that is for that. And then another issue that medical practitioners will have to face in regards to migrating to the UK nowadays is a new law that just passed the second reading in the Federal House of Representatives in Nigeria, that is stating that a doctor have to practice for 5 years before giving a license. The bone of contention is that medical study is relatively cheap in Nigeria, and the legislators are arguing that it's actually cheap in Nigeria simply because they are using taxpayers' money to subsidize it. And they believe that these doctors, whenever they graduate from their institution, they ought to serve the people who actually paid to subsidize their education. So they said the bill is proposing that a doctor will only be given a license after working for 5 years in a national institution in Nigeria.
Medical or dental practitioner to practice in Nigeria for a minimum of 5 years before granted a full license by the council in order to make quality health services available to Nigeria.
So this is actually something that if it's actually progressed to the Senate, there's a public hearing, the executive approve it, it will be a lot of headache for a lot of health professionals who always migrate to the United Kingdom in search of greener pasture. So I believe I've answered the question that some people have been asking, that okay, is United Kingdom not are they not recruiting health professionals in Nigeria anymore, in Rwanda anymore, in Senegal anymore? But they are not actually recruiting, but they welcome a direct application. And when we're talking about actively recruiting, there was a time that a country in Dubai came to Nigeria in Abuja, and they were actively recruiting medical practitioners in Sheraton Hotel. They give them a test and then they have an interview with them, and they are actively recruiting them. And then of course the process was interrupted by the DSS, and it was discontinued. But that is what active recruitment really means. So that's all I have in this video. I hope you've been able to learn one or two in this video. Kindly like this video, kindly subscribe to this channel, and hopefully see you in subsequent videos.